the screws are increased in angulation and to get to correction, and sometimes if you look closely, even the blade is bending a little bit, and this is a big advantage of the A-plate compared to the blown staple, because the blown staple is not moving, the blown staple keeps in the same position, and so it is not for those young indications. So when we started, we had a lot of questions. We were thinking, how safe is this procedure? And did we learn anything? Could we use the A-plate for the leg lengthening as well? Is it working like the blown staples? And are there still open questions? And I want to go with my lecture to all these questions. The first is, how safe is the procedure? And we look closely, is one plate correct instead of 3 staples, which we have done before? How often are we confronted with loosening? Do we cause any damage to growth plates? How long is the surgery? And how should we have the after treatment? So when we had our first series, we had 49 Finnish patients, 2 female, 29 male. There were 112 8 plates. And we used them in 13 cases with leg discrepancy and in 38 cases in angular deformities. 14 distal femur, 23 proximal tibia, and 12 combined. And we investigated under these questions. So at the implantation, we started to be very conservative, but we still had very young children as well. The average age was girls 10.8, boys 12.2. That's very ordinary numbers. The hospital stay was for implantation 5.8 days, for explantation 3.3 days, and the duration of surgery was for implantation 35 minutes per plate, and for explantation 20 minutes per plate. The average time of guidance, so the average time the plate in place, was through 332 days, so nearly 1 year. And the correction speed in the distal femur was 0.6 degree per month, and in the proximal tibia 0.77 per month. So that is an important question. How often do we have to X-ray so you can estimate how quick this will correct? Complications. Yes, the A-plate as well has complications. And we found 2 loosenings out of 112 implantations. We had 1 overcorrection. That was a patient who didn't come back to our outpatient clinic. He just failed to come back. But we had also some painful mobilization after implanting the plates. There were 4 patients, and